Hey friends, welcome to Functional Medicine for Moms, where we take root cause approach to fertility, pregnancy, postpartum, and raising healthy families. I'm your host, Dr. Kelly Moline, a pharmacist and functional medicine consultant. Whether you're preparing for pregnancy, trying to conceive, navigating life with a newborn, or simply looking for practical ways to support your health naturally, you're in the right place. Each week, we'll dive into functional medicine, natural solutions, and honest conversations from our own family's journey, plus interviews with experts along the way. Let's get into it. Today, I have a very special episode, and I have Stephanie here to talk all about male fertility. So, Stephanie Sabourin is the Director of Clinical Services at Legacy and a fertility nurse with over a decade of experience in male fertility, andrology, and men's health. Certified in andrology, the science of sperm health and fertility, Stephanie specializes in sperm testing, fertility preservation, as well as patient and provider education. Prior to joining Legacy, Stephanie worked at Brigham and Women's Hospital in urology surgery, where she contributed to the development and expansion of the hospital's men's health program in urology. Throughout her career, she has been passionate about increasing awareness around male fertility issues and improving access to reproductive care. As Director of Clinical Services at Legacy, Stephanie works closely with patients, providers, and healthcare organizations nationwide to support fertility education, sperm health, and family building options. She is a member of the American Society of Reproductive Medicine and is widely recognized for her expertise in male reproductive health and fertility preservation. Stephanie is married with 6 adult children and 1 grandchild. She lives in Boston, Massachusetts with her husband and their 2 dogs. Welcome, Stephanie.
Thank you so much for having me.
And I should point out, so recently I've offered a preparing for pregnancy guide along with labs and sperm fertility testing from home. So Legacy is the company that I've partnered with to offer this home fertility testing with sperm testing, I should say. And so Stephanie has educated me the importance of sperm fertility, and especially with Legacy, the clinical expertise that they have, their way of testing it, and what it can actually test for, even at home. I guess we'll jump into sperm testing more towards the end, and we'll get into more male fertility now. Okay. So, Stephanie, can you tell me more about the role of male fertility? I know when we talk about fertility, a lot of times we think about women's health and testing on the women's side and women changing their diets and their lifestyle and everything to prepare for pregnancy. And I think more recently, especially, we're realizing how much male side has to do with the conception rate, reduced risk of miscarriages, improved symptoms for the women. So they really have a big input on the fertility side in general. So can you dive into the importance of male fertility?
Absolutely. I think that we've sort of normalized women doing all of the fertility workups, right? So the male partner kind of sits back thinking, hey, I'm just here for the moral support piece, you go get them. Meanwhile, sperm is contributing to truly about 50% of all infertility cases. So this is really important. And in the United States, we sort of do things backwards. In other countries, over in Europe, in Germany, in Spain, these countries always look at male fertility first. They're testing the males first. It's cheaper, it's less invasive, it's pretty simple to do. And they always start with the male being worked up. Whereas here in the US, it seems like women are doing all of the chasing of their health status. I am floored how often people make it all the way to an IVF clinic and they have yet to do a simple semen analysis test. They're doing their first one at an IVF clinic when they're ready to start IVF. That's mind-boggling to me.
Right. That's insane, especially with the expense and everything that comes with IVF, and comparatively, the lesser expense it is just to get a semen analysis too.
Absolutely. embarking on IVF, some people might need to do for various reasons, but it's definitely not something to just dive into lightly in many cases. And as we get into talking about everything, I'm sure we'll get to the point of where, for many people, they can completely bypass the need for it just by working on sperm parameter improvement. Pretty easy to do. So definitely more conversations need to be happening around the male partner in the equation.
Yeah. So I think for our listeners, there might be a lot of women listening, but hopefully their partners are listening as well. And I think we already know a lot of what the women should be doing, or they're doing a lot of the research. But now the man is saying, wait, okay, now I need to play a part in this too. So what does that look like? And when does like semen analysis testing, when should that be introduced?
So I think for a lot of men, they assume, well, I've had a child in the past or got someone pregnant before, so I'm good. Or
Hmm.
if I can get an erection, my fertility must be normal. I'm fine. Or even just that their semen looks normal or fine. So they assume that that means they have healthy sperm. None of those things are actually true. So sperm quality and sexual performance are not the same thing. You cannot tell sperm quality by just looking at the ejaculate. Fertility really is a window into your overall health as well. So I think that people need to be a little bit more proactive than they historically have been about their testing. Yeah, you can wait until you've been trying to conceive for a year. Just like our clinical standards tell us, we start working up fertility based on age. If you're under the age of 34, from a clinical perspective, we would say 12 months of trying timed intercourse, then start looking into it. Over the age, 35 and up, we would have a little lower threshold. Usually after about 6 months of unsuccessful trying, we'd start looking into things, but there's no reason to wait. And I can say, as someone who did struggle with one of my pregnancies of getting pregnant, nothing more frustrating than being a year, 2 years into trying and you haven't even started a workup. So it makes a lot of sense to sort of do this on the early side. You can prepare better and hopefully, skip over some of that frustrating difficulty of experiencing recurrent pregnancy loss or just the inability to conceive at all.
Yeah. So, in a perfect world, possibly the man gets tested before trying to conceive. That's a possibility. Or 3 to 6 months in, or like you said, a year or so into. In my guide, I also talk about how in the first month, couples conceive about 20 to 30% is the success rate. So 20 to 30% conceive the first month. And then by 6 months, it's about 50 to 60%. And then 6 to 12 months, it's like 75-ish%. So it's not a huge difference between 6 and 12 months. And that can be a long time for those waiting. So even if you have been trying, let's say the 6 months or so, and you want to take a step ahead, doing that testing could be helpful and save a lot of time and money too.
Absolutely. And also, too, I think if you know that you may be heading in the family building direction at some point soon, it's not a bad idea to do a preemptive semen analysis, take a look at where you are. Then you've got a little bit of time. Maybe you take a few months to try and work on improving parameters to optimize sperm health. There's so many benefits to that as well.
So, what would you say for general recommendations for men to optimize their sperm health, just in general? And then, what can we see with that semen analysis, and how can we personalize that more based on their testing?
Yeah. So there's lots of different things that can impact, your sperm quality. So, lifestyle factors, important ones. Some of these might be more familiar to your listeners. Other may be a surprise. But sleep deprivation, lack of sleep. None of us get enough sleep. I would say I'm equally bad at that. Chronic stress. Your alcohol consumption, not just the fact that you consume alcohol, but it's more about quantity, how much. Cannabis consumption. We're seeing so much more research around that, particularly THC, the ingredient that is in it. So that applies to smoked or edible consumption. It doesn't matter how you're taking in it. And I can talk a little bit more about that later, the specifics of what that does. Also, your body weight, so obesity or metabolic dysfunction. Those things are going to directly impact your ability to conceive successfully. Just having a sedentary lifestyle or quite the opposite, people who are overtraining or have the really extreme endurance fitness programs going on, all of those things, can play a part. Then you tackle the nutrition piece, environmental exposures, your age. There's a lot. And it's never just one thing, I find. It's all cumulative. So typically it's not going to be just, oh, this person has a sedentary desk job. That's their problem. It's usually a handful of things for most people. There's a
Yep.
lot people can do to work on improving lifestyle and parameters and things like that as well. By changing habits, switching things up. There's even the simple things of, what you do for a living, occupation can impact your fertility. A lot of people don't realize that.
So is it more of like the lifestyle, like sedentary, like you said, or the stress, or all of it with
All of the above.
occupation?
It's all of the above.
Yeah.
I think that it's the more commonly understood or known things are the heat exposure items. Most people know that if you're trying to conceive, that, the male partner should be staying out of hot tubs or saunas, maybe keep doing your yoga, but not the hot yoga. Those types of things I think are more widely discussed. The things we don't talk about are things like our endocrine disrupting chemical exposures that we're experiencing in our day-to-day lives. Some are easier to avoid and get away from than others. Same thing with occupational exposures. So someone who, for example, has a desk job who's sitting for long periods of time, or maybe someone who is in the military, or firefighters especially have a much higher risk just due to occupational exposure and even just the protective equipment that they're wearing every day. Anyone who works in industrial settings or even people in agriculture have much higher risk factors of infertility.
Sure. And we can't always change our job for this time frame. So being able to improve other parts or reduce that risk, like the sedentary lifestyle, can we be active in other parts of the day? Can we get a walking pad? Can we make sure to get up every hour and go get water or something like that? And then, you know, I think the chemical exposures are really hard. So people dealing with like chemicals for bugs or weeds or, other things like that too, that can be really hard, but making sure that we're wearing the protective equipment so we're not breathing it in as much, making sure to shower, doing detoxes if that is necessary for you too, things like that, right?
Yeah, and there's also all of those sneaky exposures as well. I mean, your air quality, that's going to be geographically based on where you live. That plays a part. Your water quality. Most plastics we're consuming are the number one source of microplastics is in our drinking water. Number two, shellfish. I live in the New England area. We consume a lot of shellfish here. So those are things to be aware of. But then also too, the sneaky exposures. I'm sure everybody listening has a couch at home. The foams that they use to make furniture contain endocrine disrupting chemicals. I'm sure lots of people are wearing pajamas. Well, the flame retardant materials that they, make them out of are endocrine disrupting chemical containing products. Same thing with drinking water out of a plastic water bottle. I cringe every time I hear that a lot of people store bottled waters in the trunk of their car. That's
Yeah.
apparently quite common. And, those waters are getting really hot. That's leaching into your water, those plastics, or just microwaving food in plastic containers. It's all the little things people don't think of. And it's cumulative.
Yeah, for sure. Hey, friend, real quick before we get back to today's episode, if you're hoping to conceive within the next year, currently trying to get pregnant, or wondering if there's more you can be doing to support your fertility, I created something specifically for you. My new Preparing for Pregnancy Guide is a comprehensive resource that walks through the foundations of fertility and preconception health from a functional medicine perspective. We cover nutrition, blood sugar balance, sleep, stress and nervous system support, gut health, supplements, ovulation tracking, male fertility, fertility testing, and even considerations for IUI and IVF. I created this guide because so many couples are told to just keep trying and wait when there are often practical steps you can take right now to support your health and fertility. Whether you've been trying for a few months, are planning ahead, or simply want to feel more prepared before pregnancy, This guide will help you create a clear plan and understand where to focus your efforts. You can find it at molinmethod.com/fertility. And because you're a listener of the podcast, you can use the code podcast25 to save $25 at checkout. All right, let's get back to today's episode. And I've also heard people say that male fertility is declining over time too. Is that true? Can you go more into that?
Yeah, we are in, and it sounds very doom and gloom when I say this, but it is true. We are in what we're calling a fertility crisis. So we are 50% less fertile than our grandparents were. There is research that support this. There were studies that were done, that have been tracking back since the 70s, watching these fertility declines. The two largest reasons we believe them to be happening are lifestyle and environmental. Surprise, surprise. It's the things that we talk about all the time. We are doing this to ourselves by living the unhealthy lifestyles that we've been living for so long. And the sad part, too, is that there are some epigenerational impacts to this as well, to these fertility declines. So they can be reflected not only in your inability or difficulty in conceiving, but also the future health of your child that could be born of these sperm. So really important things to be discussing.
And I think what's hard for people to grasp is I know someone here and there that got pregnant. They weren't even trying. People are drinking alcohol all the time. They're getting pregnant. They're not changing their lifestyle. So what do you say to those type of comments?
I hear it all the time. And it's funny because, yes, we all know somebody that had an oops, that maybe was using birth control and got pregnant. Add me to that list. And I know more about fertility than the average person does. So, it does happen. There are people that right out of the gate, first attempt and they're pregnant. But also, I'm sure we all know, and it's less talked about, people who have struggled for a long time to conceive. I was also that person. When trying for my third child, it took much longer than I had hoped or anticipated. And, it's tough because you can't it's the Mick Jaggers of the world out there, having children, or Robert De Niro in his 80s having children, and people think, oh, this is never going to be a problem for me. But there's so much more to it than that. There's always the one-offs, but the gross majority of people are going to see some struggles. A lot of people, the more you talk about it, you'll realize how many friends that you have that have experienced pregnancy loss. We don't talk about this. Or
Yeah.
just difficulty conceiving is not as commonly talked about.
Yeah, I've definitely, as I've gotten older and we've had a miscarriage ourselves, I've heard more and more people having miscarriages, and maybe it's just more talked about than it used to be as well. But it's something I would never want on anyone. And I know that sperm health, like we talked about, can also impact the risk of miscarriages, and the man's health can as well. Can you talk a little bit about that?
Yeah, specifically the DNA fragmentation piece. But yes, it does. Actually, the sperm does play a huge part in miscarriage or recurrent miscarriage risk. So when we are looking at sperm, when we do I'll start at the beginning to sort of make this make sense
Yeah.
for everyone. So when we're doing a standard semen analysis, we're looking at some key points. So we're looking at concentration, which is the count of how many sperm we see in a sample. We're looking at the volume of ejaculate. That's just a liquid unit of measure. We're looking at the motility, which tells us how the sperm themselves are swimming and moving. And we're looking at morphology, which refers exclusively to size and shape of sperm. Now, you can do a standard semen analysis. It can be, let's say, hypothetically completely normal. Everything checks out on paper, nothing of concern. There is an additional test you can do called DNA fragmentation testing. It has to be done separately from it's a different test. So you can have all normal parameters on a standard semen analysis, but have really highly fragmented DNA and not even be aware. And I'll explain why that's important, because the sperm only has one job. There's only one thing a sperm can do, that is to transmit DNA from the male partner to fertilize an egg. That's what sperm's purpose in life is. That's it. So if you have really highly fragmented DNA or breaks in those DNA helixes, I'm sure everyone has seen a picture of what that looks like. The problem is that depending on how fragmented it is, that's going to determine if you're successfully able to conceive with that sperm at all, or if the process of conception is able to continue to actually become a fetus. So maybe you will get pregnant, but this is where that pregnancy loss piece comes in, because in order to have a successful pregnancy, you're relying on a process of cells multiplying and dividing many times over. That keeps happening over and over and over until you get to blastocyst stage, and then you're an embryo and so on and so forth. But if there are too many breaks in the DNA, eventually that process is going to come to a halt. It's not going to be able to continue. This is all coming from the sperm. So that's where we get that higher level of people with the higher fragmentation have higher miscarriage risk or recurrent miscarriage risk from that. The other piece too that's really important and kind of fun, if you could take a deep dive for hours into the topic of genetics and epigenetics and sperm, but aside from transmitting the DNA to the egg to fertilize, epigenetics really explains basically how lifestyle and environment influence the way genes are expressed. If you think of it like a dimmer switch, turning certain genes up, like a light switch, right? You're turning the genes up, you're turning them down. So the father's health before conception can influence not only those pregnancy outcomes, like I talked about, or embryo development, but also placental development and the long-term health of that child. So
Wow.
all important things to be looking at.
Sounds really important. It also sounds really hard if your DNA are fragmented or like broken helixes, like you talked about. How easy is that to improve if someone
So
has the DNA fragmentation?
yeah, so a lot of it is going to surprise you, because it's actually a lot easier to improve upon than you think. And really, this is something that you have control over. This is your lifestyle, your environment. So some of the most common things I talk to people about are going to be, are you getting enough sleep? Sleep is underrated. How important getting good quality sleep is. And I'm talking real sleep. Like put your phone away. Not, oh, but I laid in bed for hours doom scrolling. No, that doesn't count. That isn't sleep. But that good quality sleep, so critical. Reducing stress, really easy for me to say, of course, because I'm not living anyone else's life. But self-care is important. You need to take care of yourself. And so doing whatever that is going to help you to reduce stress levels in your life. This can be done through lifestyle changes, but also supplementation can help as well. We talk about supplements that are important, for women all the time. Most women are taking a prenatal vitamin. They're doing everything they can do to optimize their health. We forget that there's another half to this equation. There are male fertility supplements on the market that are readily available and easy to obtain. Simple things that you have heard of, like CoQ10, vitamin C, vitamin D. These are not foreign matters, and they can make a big difference in improving not just that DNA fragmentation piece, but of course, all of the other parameters as well. And then, of course, working on making sure that you're having a good nutritional plan moving forward, that you're eating well, that you are getting exercise, but steering clear of anything that what I refer to as saddle sports. So the Pelotons, motorcycles, bicycles, anything that has you seated in a straddled position, we would try to avoid. Same thing with the heat exposures. Fun fact, testicles are on the outside of the body for a reason. That reason is that they need to be about 3.5 degrees cooler than the internal organs do. So anything that inhibits the body's ability to naturally self-regulate within a few degrees is going to cause a problem with sperm quality. So I always use the analogy of every guy knows what happens if you're going to go do a polar plunge. You're jumping in the ocean. It's January 1st, and that's what you're doing. Well, what's going to happen? Everybody knows what's going to happen. Your testicles immediately go, oh no, too cold. They pull up close and tight to your body. That's their self-warming mechanism. Well, same thing if you live in Arizona and it's August and you're going on a hike, it's 120 degrees in the shade. What is happening? Well, your testicles are going to pull away from your body. They're going to hang looser and lower. That's their self-cooling mechanism. Now, the problem is if you're putting yourself in a situation for any prolonged period of time that isn't an instant cold plunge and getting out, or an instant, I walked outside to my car and then I turned on the air conditioner and I was fine. Those things are okay. Your body can self-regulate. But when you submerge in a body of hot water, like a hot tub, or you're in a room doing hot yoga, your testicles can't pull out of that environment the way they would need to, if they were doing a quick self-regulation, or they can't pull close enough to your body if you're soaking in that ice bathtub. It's too long, and that's where you're going to see the negative impacts. All of those things, though, halting those can help to improve your sperm quality directly and pretty quickly.
If you're trying to conceive and looking for a natural way to better understand your cycle, I personally love and use the KEG fertility tracker. It's actually what I use while trying to conceive Danielle. KEG is a medical grade fertility tracking device that gives personalized fertility tracking through cervical fluid patterns in just 1 minute a day. Unlike ovulation strips that only predict a hormone surge, KEG helps identify your fertile window in real time. A few things I personally love about it: it's a one-time purchase with no monthly subscription fees or ovulation tests. It comes with a 12-month pregnancy guarantee or your money back, and you can use HSA or FSA funds to purchase it. If you want to check it out, you can use my code Functional Medicine for Moms for $20 off, and I'll have the link down in the show notes. Again, that's Functional Medicine for Moms for an additional $20 off the KEG fertility tracker. How long do you see it take? I'm sure, like, if there's a lot of improvement to do, it can take longer time, but in general, what do you see for that time?
So the spermatogenesis process, right? So sperm are a little bit different than eggs. Women are born with all the eggs they're ever going to have in their lifetime. Men, it's the opposite. They're constantly forming new sperm year over year. It's happening all the time, well into their 80s. The quality is not great in those age points, but it's happening. And so that sperm life cycle is anywhere from 72 to 74 days. So you're seeing a constant turnover of sperm. So when you've made improvements in lifestyle, in your environment, and all of the things that you need to do, you're getting healthy, you will start to see slight improvements within a matter of 3 weeks, as early as 3 weeks. But peak improvement, I typically tell people, think in 90-day increments, right? So a semen analysis report is sort of like a report card, gives you a picture of what the last 3 months of your life have looked like. So yes, you'll start to see some improvement in a few weeks of life improvement, but really to see the peak benefits, you need to take it a full 3 months, because sperm do not cycle at the same time. Every day, new sperm are coming into maturation. Older sperm are being a combination of both expelled from the body and reabsorbed by the body. Both things are happening all the time. And so there's this constant turnover that's happening as they're cycling. So you really want to give it a full 3 months to see the peak benefits of what you've been doing.
Perfect. And then I'm assuming if there's a lot of health things that we want to improve, it can take even longer than 3 months because we're continuing to improve the health.
Correct.
Sure.
And we like to see people make as many improvements as possible, obviously, as quickly as possible. You're only going to benefit not just your fertility, but there's obviously other benefits to living a
feel
healthier
better.
life.
Yeah.
Exactly. But for some people, certain things are harder to give up than others. So sometimes we try to start small and say, okay, that's great. You work out on your Peloton every day. I love that. I love that you're exercising every day, but maybe we can switch it up and get off the bike a little and do some more jogging or walking. Or maybe, you make the small changes until you get to the bigger picture.
Yeah. And then I think in my age group, especially, we have other substances. We already talked about alcohol, and then there's more nicotine involvement as well. And I think everyone understands how bad cigarettes are and how that affects fertility. And then we also have a lot of studies on the cannabis, like you talked about. But can you talk more about like nicotine specifically, like the Zyn, the vaping, the stuff that's more popular now?
It is. It's such a problem because some people think, oh, I'm not a smoker. I don't smoke cigarettes, so I'm fine. But they're not fine. It's not the method. I say the same thing about cannabis. People assume, oh, I don't smoke, so it's okay. I take gummies or some sort of edibles. But it is the same. And, whether it's the Zyn or the vape, people assume that it is the actual lighting of a cigarette and smoking that is the problem. It's not. It's the nicotine. It's the ingredients in it that are the problem. And there's all sorts of bad things that come from cigarette smoking and tobacco consumption. It causes vascular issues. You need your vascular system to be functioning properly to conceive. You think about, we're talking small tubules and vascular things. But also you want to be at your healthiest, and you want to have better levels of DNA fragmentation. Nobody has zero, but you want that number to be low, not high. And I think that the problem also that I see clinically is the people who are using Zyn are consuming so much more, same thing with vaping, so much more nicotine than they would if they were smoking actual cigarettes,
Okay, yeah.
because they're just popping them in. You don't have to leave your office space, leave a room, leave a building to do it where you do with cigarettes.
Mhm.
Most buildings are non-smoking or office spaces are non-smoking. So people would have to go elsewhere to do it. Whereas some of these other things, they're so easy to use in public spaces or where people don't have to leave a room or a building. And you find that they're using it so much more. Um, I experienced this with a friend of mine who was trying to quit smoking, and she switched over to vaping, and she's like, this isn't any good. I'm like doing this way more than I was smoking. And I said, no, this isn't good. I think we need another plan for you. So yeah, being aware of what you're consuming. Same thing with cannabis products. People think of it as, oh, I hear it all the time. This isn't that big of a deal. It's legal in so many states, depending on where you live
Sure.
now, quite readily available. So people assume it must be fine. It's not that bad. But the cannabis of today is not what it was in 1970. The THC concentrations are a lot higher. They are very different. And all of these things matter. Dosage matters, potency matters, and frequency matters.
Sure. And I like that you pointed out the gummies too and the edibles because I think a lot of people don't think of that. They're like, oh, I'll just have a gummy with this or a social thing. It's a lot more normalized. And then one thing that you talked about as well was age for men and having a previous child and thinking either or that, oh, it's fine. Like we've had a child before. And so everything must check out. So just like we talked about having improvement in sperm health and lifestyle health, I'm assuming it can go the other way too, where it can go the wrong way and we can have, times where our sperm are hurting even though they've been good in the past, right?
Right. And there are things that you can improve upon with life, like I said, lifestyle, environmental changes, things like that. But there are things you can't get away from. One of them is your age. Every year you are 1 year older. There's nothing you can do about that. And with every year of age comes declines in sperm quality. Motility declines year over year for everyone. Morphology decreases every year over year. Same thing, DNA fragmentation increases every year. These are just related to age alone. So there are some things like that that you can't escape. There is also something called secondary infertility. There are people who have no issues whatsoever, conceive the first time right out of the gate, and then they're trying for baby number two, and it just isn't happening. And unfortunately, sometimes we don't always have a clear understanding as to why. I always tell people, listen, there's the science piece and the nature piece, and I can't always explain. Sometimes we have answers, sometimes we don't. But at least if you know that you're doing everything you can do, yourself and your partner both, because it's a two-way street, to improve upon parameters, to put yourself in the optimal position, and I'm not here to shame anybody about their lifestyle or what they're doing. That is not the point of this conversation. It's really hoping that, if we can even make a difference for one of your listeners, if one person takes away something that we've talked about today, makes an improvement, and conceives successfully, well, then we've won, right?
Yeah, for sure. And I know that women think a lot about like their personal time clock. And so you talked about how males' the health will decline over time as well. Do they have, I feel like it's always the thought of, well, men have infinite amount of time. So I guess at what point do we start to get like more concerned about their age as well?
So for the male factor, yeah, I always say, I'm so offended by the term geriatric pregnancy.
Yeah.
Like, because there is nothing geriatric about a 34, 35-year-old woman, for starters. But that's a whole nother conversation. For men, it's a slightly older age. They have a little bit more time before we start to see some pretty significant swings in sperm quality. Men over the age of 40 have a 6 times higher likelihood of producing a child with a congenital condition. So this could be something like schizophrenia, bipolar, autism spectrum disorder, or even childhood cancer. So something like that would be really concerning, as a parent for me. Things that you want to think about that you worry about, and that is just due to sperm age alone. So it typically, we give men a little bit more grace period, but it's like that age 40 and up, and really there starts to be a pretty good decline, and it's going to be continual year over year. It's going to continue to decline. So those risk factors, stay elevated and the quality sort of drops off.
Sure. That makes sense. So, yeah. So, kind of from this conversation, having some action steps for our listeners. Obviously, we talked about how it's a two-way street. So, not just the women partaking in their fertility journey, but the men owning their fertility side as well. And they're truly half the equation. Like you said, about 50% of infertility cases come from the men themselves. So things that the men can do were a lot of those lifestyle changes, reducing stress, improving sleep, improving metabolic health. I know we talked about or we talk about PCOS or PMOS for women and how metabolic health really affects their hormones. But same thing with the men and improving as much as the body and the health we can. The sperm is a really good indicator on the health of the man in a whole. And so for sperm and semen analysis, there are several different methods that they can do, but I really like Legacy because it's an in-home kit. So it makes it really easy and non-invasive and private. And then they can send that and get the results in a few days. And they can do that preemptively. So there's a couple different options with the more standard and the advanced with the fragmentation part of it as well, especially if you have older age or history of miscarriages. That would be more the route to go. So you can do it right when starting or when you're about to start preparing for pregnancy or start to try to conceive, or a few months down the line. Obviously, if you've been trying for a year or even longer, it would be a great time to do semen analysis testing as well, especially if you're considering IUI, IVF, or fertility clinics in general.
Yeah, I think testing earlier makes a lot of sense for people. You can focus on some realistic strategies to improve your sleep, your exercise, your nutrition, your stress reduction, reducing alcohol, nicotine, cannabis intake, manage your metabolic health, do all of the things that you need to do. I always tell people steer clear of anything you get from a guy at the gym out of a duffel bag, usually bad news for fertility. Think about your supplement plan, strategically, right? Giving yourself a couple of months on supplements to get those sperm parameters to where you want them to be for peak conception success. You can save a heck of a lot of time and stress and frustration if you're a little more proactive on the front end. And like you said, it is so easy to do. Being able to do these things from home, you do not
Mhm.
need a day off of work. You do not have to have that awkward in-clinic experience that nobody wants to have, going in the room with the black leather couch that 400 people have been in prior. Nobody wants to do that. This is sort of a no-brainer. It's cheap, it's fast, it's easy. And then you have the opportunity to work on improving to where hopefully you would see successes much sooner.
Yeah. And something that I like to talk about just to wrap it up a lot. But I talk a lot about not just the goal of conceiving, but having that healthier pregnancy, having less symptoms for the woman during their pregnancy, having a healthier baby, having a full-term baby. All these things the man contributes to as well, and the sperm health matters.
Absolutely. I think we need to normalize men being more proactive about reproductive health the same way that we encourage women to be proactive about theirs. And the fertility conversation should never be whose fault is it? Is this you or is this me? It should be how do we, as both partners, optimize having the healthiest possible pregnancy we can? That's the end
Yeah,
goal.
right. And so, if you are already trying, obviously you can make these changes now. If you're thinking about trying, making those changes as soon as we can, but preferably at least 3 to 6 months, I say, to make those really good changes and make the impact that it matters for both egg and sperm.
Absolutely.
Perfect. Well, thank you so much for joining us today, Stephanie, and for all your insight on male fertility.
No, thank you so much for having me. It was a great time.
Thanks so much for listening to my podcast, Functional Medicine for Moms. If you enjoyed today's episode, make sure to subscribe so you never miss one, leave a quick 5-star review, and share it with your mom friends who love it too. I'm Kelly with a background as a pharmacist and training in functional medicine. I help women move past fatigue, brain fog, gut issues, and hormone struggles so they can thrive in everyday life or prepare for a healthy pregnancy. Through lab testing, personalized supplements, and functional medicine coaching, I help you feel better, faster, naturally. Want to connect more? Head over to molinmethod.com or come hang out with me on Instagram and YouTube at Functional Medicine for Moms. On my site, you can order professional grade supplements at my discount or book a free discovery call if you'd like to see how we can work together on your health. This podcast is for educational purposes only and not medical advice. Always talk to your provider before making changes to your health plan. And remember, healthy moms raise healthy families. Catch you next time. New episodes released every Wednesday.